this is for a lot of people their first webinar. So let me just welcome everybody. If you are looking at starting a business, working from home, this is the perfect time to do that, isn't it? Yes,
absolutely.
It just happens to be the right time in history. We're at the right place at the right time, and so are you. So we're going to cover today the kind of money that can be made running a medical billing franchise. And by the way, we use that term franchise in the generic way. If you look it up in Webster's, it just means that a business has got a certain system that they present to you that you can present to the world. And that's basically what ours is. That's why we call ourselves American Business Systems. We got everything put together. It's kind of like I don't know, it's like everything in one.
Yeah, absolutely. Now, Patrick, I mentioned earlier is that this is something that's been a family business from a long period of time. So kind of tell us where it started, where it is today, and where it's going.
That's way back. As you can see from my hair there, before I started dyeing it gray, that's 1987 or so. That's my wife, Linda. She started doing medical billing for a friend who ran a durable medical equipment company here. And she was billing Medicare for his equipment that he rented out and sold. And she didn't know a thing about medical billing. He called her up and said, "Hey, can you do some medical billing for me?" She said, "Well, I don't know what that is. I mean, I've seen medical bills, but I don't know what a bill is that you would submit." He said, "Just come into my office and I'll show you." And literally in about a day and a half, he showed her everything she needed to know to start doing his billing. Now, remember, this was back when she was doing it on a typewriter.
Yeah.
Yeah. And so it was just on paper. She just had to type in and fill in some blanks and then fold it up and put it in an envelope, address it, put a stamp on it, and get it to the post office. But that's how you file those claims with insurance companies and Medicare. Yeah,
absolutely. But that was when you and Linda got started. But the little guy in the middle is no longer a little guy. This guy is as tall as you, if not taller.
Yep, that's my son Adam, and that was again back in 1987. He was probably, I don't know, 9, 10 years old. And here, as you can see, we're about the same height. His hair will start turning gray soon.
Well, he's got teenage boys and teenage girls, and I'm sure it'll be turning gray sometime soon. But he's kind of taken over a new role here. He's not only the CEO, but as he has actually authored some books himself.
Yes, this is his latest book, The 9 Ways Doctors Let Money Slip Through Their Fingers. Now, folks, just think about this just for a moment. This is perfect timing for this book because doctors really are letting money slip through their fingers. And we point that out. You'll notice that he's co-authored this with Dr. Vicki Ratner, who's a retired general surgeon. She also now consults with doctors on how to build their practice. And one of the things she said was, Adam, we really need to write a book showing these doctors why they're letting money slip through their fingers. And we can help them stay in private practice by writing this book. So there it is.
Yeah, and that's what's been so great about this, folks. Is again, I've seen Adam's children, which are literally teenagers now, when they were little bitty, but it's just been wonderful to be a part of a family, to see this family grow but grow not only just generally in age and everything, but grow in what the business has been able to do. And Adam taking over and as the CEO of American Business Systems, and he is busy working on getting a lot of the new services, adding new things to ABS. So, folks, this is a great company to be a part of. It's going to have an incredible length of longevity. So it's an exciting time here, and there's been just great things, even through what we know of COVID, or when we went through other issues with the government on Medicare stuff. ABS has stayed steady in growth, and we've seen that not only just within the business of ABS, Patrick, but we've also seen that with our licensees. And it's because of factors like I'm going to share with you right now. I mean, healthcare revenue cycle management is still growing. I mean, Patrick, I remember when you and I first started doing webinars 10 plus years ago, people were asking us, is this going to be something that's going to be here next year?
Yeah, we used to wonder that, Linda and I, back when we were filing those paper claims. We thought,
right,
well, if doctors all get computers, which they were all moving, towards computers in the 90s, and if they all get their own way of sending these claims electronically, we'll probably be out of business. Well, The fact is that doctors need help more than ever. They do not like messing with the billing inside their own office because they have to keep up the software, updates to all the codes. All of the patient data is residing on their computer in their office. So if it's stolen or wiped out by a fire, I mean, they've lost everything unless they do backups every night, which most people don't do.
Right.
Anyway, so the point is that, as you can see, this is growing. And the revenue cycle management market, that's what we are in, and that's what you would be in, folks, if you joined us as a business owner with us. It's rising at 12% and will reach USD 90 billion. Eric, I never thought I would see those kinds of numbers, but hey, healthcare is what, like 1/5 of the economy right now.
Yeah, absolutely. And you can see here, it just says right there in 2019, it was 45 billion. And by 2026, it'll be double that. So folks, if you're looking to get into a business, and Patrick has said this, Adam says this, the entire team says this, if you're looking to get into a business that you can work and work from home, that has longevity in it, obviously this is a market to be looking into. I mean, there's a lot of other franchises and business opportunities that are out there. Some, yes, you can make some money. Some you're going to work really, really hard at trying to get going here. But Patrick, healthcare is just not going anywhere.
No, I think as long as there are human beings and human beings get sick and go to doctors, the doctors have to get paid. Somebody has to bill somebody for that doctor to get paid, because even if the patients have to pay it out, they've got to bill the patients. But, you know, they're mostly working with insurance companies and Medicare.
That's right.
Yeah.
You know, there's some more statistics, and we're going to just kind of go through this a little bit, but this report was pushed out not too long ago, the State of Independent Practice, an industry report. Now, Adam sent this to both you and I, Patrick, and we thought, man, this is something great just to kind of go through this, because again, this is not anything that ABS is pushing out. This is something that, you know, people that are much better at numbers and figures than I am and you are, Patrick, that can put these numbers together and do this kind of study. The practice growth outlook is just growing exponentially.
Yes, it is. In fact, I don't know if you can see this or not, but I'm going to underline something here. This is the 2021 State of the Independent Practice Survey. And so this is very up-to-date, recent. And look what it says right here. 75% of the practices expect to grow this year. Yes, even though we are going through halfway through the year now through a pandemic, practices are growing. Eric, they're growing because, first of all, that means that more patients are going into the doctor's office, not just for COVID, for a lot of different things. They're now picking up to where they're doing their elective surgeries now that they weren't doing last year. And it's just booming.
Right.
So,
it is certain. I mean, even that second, it's 75% of practices, but for the sake of those that are on the call today, you can see actually in that second paragraph, we're talking about independent practices are expected to grow. Because I know a lot of people think, Patrick, already that, gosh, aren't a lot of independent practices being sucked up by the hospitals or being sucked up by big corporations? We're talking independent practices. This is their growth here.
yes, and that's important for people to know, that independent practices will always be around. There will never be a time when we don't have independent practices, and that's your key market. We're going to show you in our training. We do virtual online training, one-on-one with instructors. We're going to show you exactly who those people are that you should approach and how to find them in your area. Look at this chart. This is from that previous slide, but It's your prediction for patient volumes ahead. Well, 75% say the practices will grow. Some of them say they'll shrink and practices will stay the same. But as you can see, the majority of doctors surveyed said, yes, this is going to grow for sure.
You bet. And again, folks, we're just trying to give you some data here. And if you want to get a copy of this, I'm sure that the individual that you're working with, they'll get you a copy of this slide deck. We don't mind sharing this with you so that you have the stats that you can share with maybe a business partner that you might be working with or somebody else in your family. But these are, like Patrick said, this is 2021. This is very recent. So, you know, just basically in summary, you see that how how practices, how independence is going to grow. I mean, obviously it's through requiring new patients, reoccurring visits, and then that's not even half of what we're going to be able to see as patients need to see the doctor. There is one of the great things that ABS has done. They've tapped into the virtual care market. So we're talking huge growth here on certain things. You can see here, one of the biggest things that's happened is a need for integrated technology solutions. And ABS is staying ahead of that, especially whenever it comes down to the whole revenue cycle management. So Patrick, congratulations to you, and kudos to Adam and all the things that he's bringing to the table.
Look at that right there at the top of that chart, for example. It says, how important is each initiative to helping you face particular challenges in your practice? The number one thing that
Yes.
doctors say they need is the need for integrated technology solutions. Eric, haven't we had an integrated solution now for about 8 years?
Yes, absolutely.
Yeah.
Yes. And that's why I encourage you, if you haven't seen a demo of the iClaim EMRX platform, get back with the person that invited you to the webinar today and ask them to see a live demonstration of that. They'll take you through a tour of that. They'll take you through every single step of that. This is just another repeat of that, just so you can see a little bit larger. But Patrick, just what you said, the complete integrated use of iClaim and EMRX. And again, they will be able to take you even deeper than what we can show you right here in this slide deck, because you're right. And a lot of the other services are actually help integrated inside the system.
Yes. Let me just say a moment here, Eric, about the integration. Ours is a cloud-based system. Now, folks, there's two kinds of software. One's a cloud-based software. That means you can go to any computer that has an internet connection and log into a site and start using the software. You probably do that when you go to do your online banking, for example. Well, there's another type called server-based. That means it's actually on a server or a hard drive. And that's the kind that you actually get from most companies. I don't know if anybody else that does what we do, Eric, and trains people and supports people in medical billing that has a cloud-based system. All of it is server-based. If you ask them specifically, do I have to install something on my hard drive? The answer is yes. And that includes the patient data that will be stored there. Very dangerous, right? Because if that gets stolen again, you've broken about 12 HIPAA rules for privacy of the patient data.
Right, and you only need one to get nailed. So especially in our world and time of technology. So again, ABS has stayed ahead of the technology, making sure that you have what you're going to need, and really what the doctors need. And really, at the end of the day, if you really know what you're doing, you're making the doctor's job a little bit easier. The nurses that are in their practices easier, and really, what that does, it actually helps you provide your entire community better healthcare system. So, Patrick, before we launch into really what people can make, let's kind of talk about some of the things where doctors are struggling. Obviously, a lot of money's wasted. It's just on administrative techniques, and then the next thing we're going to talk about is, why would a doctor want to outsource this versus doing in-house billing?
Yeah, 24 cents out of every dollar is wasted on the administrative and billing expenses. So that's because you've got to pay somebody pretty good money inside the doctor's office to do the billing. They have to continually be updated and trained and know what's going on. And Eric, can you imagine any other business that 1/4 of all their revenue is just wasted on the thing that we can eliminate in a doctor's office by outsourcing that billing to our business owners all over the country? Doctors don't have to spend a dime on anything inside their office. No computers. Look, here's a breakdown of that. In fact, see the in-house costs there? This is what we've calculated that it would cost a doctor to do billing inside his own office. If he just had 100 claims a week, that's 20 a day, times $100. 52 weeks times, and 6% is what we put this in this chart, because that's a minimum that you'd charge a doctor. And that's $31,200. So that's what the doctor would pay you. That's it, to outsource everything and get all the headaches out of their office. Otherwise, they have all those expenses that you see there that add up to $65,000.
Absolutely. Folks, just as a quick reminder, just remember that we've got Q&A open up here. So if you got any particular questions that you have for Patrick or me, please type that in, because what we're going to do right now is kind of shift gears. We kind of laid out a few things, just really what's going on in the real world out there with medical billing. Is there a growth part of it? Absolutely, there is. We can see that independent doctors are actually growing again. The pandemic that we've just gone through and what we'll continue to go through, that's kind of evened out a little bit in the where there was some type of a shakeup. And Patrick, you've actually said many times that great opportunities come through major disruptions in the market. And obviously, as bad as some of what we've seen, whether it's personally or throughout the country, there's been some disruption, but out of that can take some great opportunities for people like that are on the call today.
Yeah, and that holds true in a lot of industries, but it's amazing how this industry, we made it through the 2008
right.
Downturn in America, and the business was horrible in most industries, not with ours. People still got sick and hurt.
Yeah, absolutely. And and this will help you understand, what your return on investment, how you can get it, how quickly you can get it back. And so a lot of people, Patrick, want to know what their ROI is, and to break that down, and that's just the simple return on investment. Why don't you talk real quickly about what the investment is? You can kind of share a little bit about what they get for their investment, and then we'll start taking them through what kind of money that they can make with just a couple of doctors already.
Yeah, actually, this is the most amazing business, Eric, that you have people sign up with us as business owners that have had their own franchise in the past, and they were paying royalties. They were limited on the territory. They did not have the return on investment. In fact, Benny up in New York,
right?
Benny's been with us several years now, and he says, Patrick, I had a franchise when I bought your franchise, and I never made a dime with it. It was a janitorial service or something, but he'd had it for a year and a half. And he said, I always spent more money than I was making. And by the time I paid advertising costs to the main company, the franchisor, and royalty fees and all that, I didn't make anything. Well, with this, folks, you can make that back fairly easy. So we do have a little thing there on the website, as you can see, income potential. And then under that is medical billing income calculator. So we're going to go there, at least with screenshots here, and show you what you could be making from this business.
You bet. Before we do that, Patrick, let's answer Larry's question. And Larry, that's not a downer question. He's saying not to be a downer, but what do the doctor's office do if their internet went down for a few hours or an entire day? What is the backup plan for our clients, even just temporarily? I will start this off, and then I'm going to kick it back over to you, Patrick. But a lot of doctors' offices are utilizing more than just their medical billing for internet services. So the doctors already have backups for their internet, because they're relying upon X-rays and what they're doing to get prescriptions out the door. A lot of what they do is internet driven already.
Right. Yeah, the patient portal that they use. In fact, in today's world, it's just unheard of. I shouldn't say that, because my Wi-Fi went down one time this year, I think, for about an hour and a half, and then they had it back up. You know what I did, Eric? I did what we suggest all of our licensees do, and that's just simply switch over to their phone and turn on the hotspot on their phone.
Right.
And all of a sudden, I had Wi-Fi connection. Now, was it as fast? No, a little slower. But still, I was amazed that I could actually run the business that I'm running here just using my phone connection. And so anyway, the point is, you always can have some kind of connection to the internet if you want to. And if your phone doesn't have that, then ask your provider to give you the what they call a hotspot on an iPhone.
Yeah, you bet. Yeah, that's easy. It's easily done.
Or just run down to your local McDonald's, take your laptop with you, and you'll have internet connection.
One more question we go before we get into this, because this is important. And Katrina's asking, how do you get about getting the doctors to become a client? Now, Katrina, we do a lot of different webinars. I think we did one just recently, Patrick, not too long ago, about some marketing, but that's a great question. Ask the person that invited you to the webinar, and they can do a couple of things. They're going to go through step by step of what it's going to take to get that doctor to become a client. And then secondly, they're going to point you into some directions of some other webinars that we've done on an extensive layout of what we do as marketing, and then obviously talk to some licensees. That's so important, and that's a great question to ask those licensees. Patrick, you want to add any more about to that question before we move on?
Well, we've done so many webinars that are specifically on the marketing, and for this webinar, we just haven't focused on that. But there are a lot of them out there on our YouTube channel, and we'll show you how to get to that here towards the end.
Great. All right, so let's get on over to what is the ROI. So you can go to the website absystems.com. You can go over there and get into that area where we just were, which is right there at the top where it says income potential. That'll open up into here. Now, Patrick, I think we've already got it set to where there's showing one doctor with 20. Correct me if I'm wrong. That's already set there, correct?
Yes, I think that's the default when you go there. Seemed like we might have updated that to 3 doctors or whatever, but you can put in any number you want. We started with 1 because we wanted to show you the ROI, the return on your investment, with 1 doctor seeing 20 patients a day, working 5 days a week. Some of them work 6, and charging only 7%. Remember, folks, when you bill the doctor for your billing services, you're going to be charging them a percentage of everything that's collected. So it could run anywhere from, I've seen it, 6%, 7, 8, 9. It just depends on the doctor, the type of specialty, and so forth. We help you with that when you make your proposal to doctors as to what you should charge. And of course, it's always negotiable, but you'll make money, believe me, just about at any percentage. In this case, 7% of $100, that's a typical visit to a doctor. We just rounded that out.
And you know, Patrick, that $100, that's about average, because some insurance companies, especially like Medicare, they may not pay a full $100, but Blue Cross and Blue Shield, Aetna, you know, whenever you go see a doctor just for a regular cough or cold, and then you always ask them about, well, what about my elbow? Well, all of that gets charged. Anything that the doctor starts talking to you about of some type of an ailment, that actually adds more time on their spot. So, you know, even at $100, that's a little bit low. So these numbers are either average numbers that we're showing you that are actually below even the number of patients a doctor sees in a day. We're trying to even be very, very careful about what we're even showing you on that. And then once you do, click on that where it says submit. And then what you do right there when you click on submit, there's your number right there, the ROI on just 1 doctor's office. Yeah,
$36,400. Eric, that's about $8,000 more than our investment, our licensing fee, we call it, which just is it's like a franchise fee. You basically pay that one time upfront. It covers everything, all your training, all your marketing materials, over 2,000 pieces of printed marketing materials, and of course, access to our online licensing website that has over 100 hours of training in it. And of course, you also have the 10 modules, which we'll talk about a little bit later, that's given to you live with one of our certified instructors.
Absolutely. And so what we're going to do right now is kind of take you on a tour of how that gets broken down, because you know, Patrick, everybody wants to know where's the smoke and mirrors on this? How am I going to get to that $36,000?
I've had that actually said to me, Eric, by people I've talked to, like, well, Patrick, this seems too good to be true. What's the catch?
Right. What is the catch? It's always the great answer there. What is the catch?
The catch is that you have to work.
Absolutely.
If you order our training and go through the training and then put everything on the shelf and don't do anything with it, of course, you're not going to make anything. But for those people who have, Eric, as you know, we have people not making just 6-figure incomes, but bringing in 7-figure revenues.
Absolutely. Yeah, absolutely. So let's talk about this on one doctor. Again, we know that on average, one doctor is going to see 20 patients a day. And again, folks, this is just the simple math of where we are and of how we're getting to those numbers. Because you can do this yourself, or again, once you feel pretty comfortable about just using that income calculator, just use the income calculator and put those bigger numbers in there. But you may want to bump it up from 20 patients to 25 patients. But again, just taking this, each patient is valued at $100 per patient. You can see that. Obviously, that brings in about $2,000 a day in revenue for that doctor's office. And Patrick, I think what happened with, I want to kind of just go off here and just have a little sidebar. A lot of doctors were already behind on getting some of their billing done, that they were actually probably getting less than $2,000 right before COVID and all of this. Some practices literally closed down because they couldn't pay the rent. I've known a doctor here that's close to me that even reached out to me and says, "Hey, can you help me with my own billing, because I'm having to borrow from the bank just to make payroll." And I feel sorry for doctors that are that way, that they just didn't have the right biller or the right billing company on hand already.
Yeah. And, $2,000 a day may sound like a lot of money to you and I, and it is, obviously, but think of the overhead that the doctor has, all the staff, all the rent, the insurance, equipment that he's paying on. I mean, there's no telling how much of that he ends up with at the end of the day. It could be as little as a couple $100.
Right. Yeah. So if you take that $2,000 per day and you're doing the billing, and then we just broke it down, that's, you're going to get 7% of that. Well, that's about $140 a day for you. And Patrick, what the great thing about this is again, because people always want to know, how many doctors can I handle here in the beginning, maybe without having to hire anybody? And we've got it broken down to that typically a doctor that has this type of volume, it's going to take you less than 90 minutes a day to do that actual billing for that doctor.
Yeah, people find that hard to believe, but folks, we're just talking about 20 claims, and each one of those claims could take you maybe 3 minutes. So, right. It's just, you do the math, and it's just amazing how fast you can get through, especially if they're a repeat patient and you don't have to put any patient data in. It's all just, here's the thing that the doctor found wrong. Here's this code for the thing that the doctor did to help him get well, and boom, you're done.
Absolutely. And then with that, again, $140 a day times 55 days a week, that's $700 a week times 52. Again, you get to the grand total again of the $36,400. And again, that's with one doctor. And then so I think what I understand, that on average, most of our licensees average 5, 6, maybe 7 doctors at a time. But I think that's where people can handle without maybe starting to have to hire folks.
Yes, that's exactly right, Eric. The people I interviewed over the years, and I've interviewed over 100 licensees or business owners, they've said to me, "Patrick, I could have had this much bigger if I'd wanted to, but this is how I like to keep it, just like I'm doing right now. So I don't have to hire anybody else." So they may have 5 or 6 clients, and that's easy for them to handle that themselves.
Absolutely. So what we thought we would do is put in basically that number. So the only number that we changed into the ROI potential here is the number of doctors that you would actually have as clients. Just keep that number there with seeing 20 patients a day. Obviously, that's going to be 100 claims that you're going to be doing in a day's time. Open 5 days a week, keep that same number, the 7% on the $100. And then you hit submit right there. And then what that's going to get you there is, let me see if I can get that. I believe that says $182,000 a year, $15,000 in monthly income. And Patrick, I think that's what most people think of is, where do I break even on, or where do I break that threshold of that 6-figure income?
Yes, and that's why we showed 5 doctors. It wouldn't take 5 doctors, obviously, to get to $100,000 a year if they all fit the numbers that we just saw. Remember, it's all hypothetical, but we get these numbers from our licensee business owners from coast to coast. They tell us these numbers and what's averaging out there. 7% is what's the average of what they're charging, and the number of patients a day per doctor is 20. So we take all that and plug it in here just so that you have some feel for that. You can plug your own numbers in and create your own dream of what your business should be.
Absolutely. And Patrick, why don't you answer this question? I know that we're not technically talking about marketing today, but how does one get from 1 doctor to 5 doctors? doctors? Just kind of tell the story of what some of our licensees have done just to get from 1 to 5.
Well, remember, we teach about a dozen different ways in our online live training workshops. Our certified instructors are licensees themselves. Mm-hmm. They've been running this business themselves. They know what works and what doesn't work in any given environment that's out there. And so when we teach you the secrets of what we found out that it takes to sign up a doctor, that comes from 27 years of experience and honing that down month after month to where it actually uses only the things that work. And so when you get to that first doctor, again, we're not going to go into detail about that, but let me just put it this way. We're going to make you stand out amongst all the other medical billers that might be anywhere in your city. I mean, in ways that you can't even imagine. We're going to make you almost a co-author to a book, for example. We're going to give you the credibility you need to go talk to those doctors and show you how to actually use those tools to connect with those doctors. But the point is, once you sign up one doctor, Eric, it's just the sky's the limit. I've had licensees I've interviewed say, Patrick, I just did what you told me to do, tried 2 or 3 different things, finally found my first client after 45 or 60 days, whatever it took. But once I had that client, the referrals from that doctor grew my business. Absolutely. And I've never done any marketing since then because the referrals, folks, doctors know one another. If they find somebody that can help them with their cash flow, believe me, they're going to refer you to other doctors. And those doctors, by the way, could be in other states. Eric, as you know, we have licensees who have clients all over the country, and they did it all just through the phone and internet because you can do that nowadays.
Absolutely. And that, folks, that kind of helps answer another question there. What is your market? How big is the market? Is the market saturated? If you look at the United States and you feel like the United States has been saturated with medical billers, that hasn't happened. Because again, there are new doctors are coming on. There are doctors that are needing help. There are practices that have kind of blended together and they need help. So matter of fact, I talked to another doctor just 2 days ago, again, saying, it is so critical to find the right medical billing company to outsource to. That is probably one of the biggest decisions a doctor will make because they know that is going to either make or break them. And so being a part of ABS is actually going to help you make sure that you have all of the right components so that the doctor is very happy about what they've been able to do, because doctors do know they got to get that billing out of their office. And go ahead, Patrick.
Well, I was just going to say, people don't realize that doctors do listen to what's said by their other doctors. And so when we say that you can be have your name on the front cover of a book with a doctor, Dr. Vicki Rackner, like I do, that gives you such huge credibility that it just opens doors that would never be opened otherwise.
Absolutely. And so, folks, what we've shown you so far is just basically what you can make of just doing on the medical billing side. So one doctor, you can see it can produce about $36,000. 5 doctors get you well over $100,000. As a matter of fact, you can probably put in 3 doctors and that gets you up over that $100,000 mark. What you're trying to think of, what is it going to take for me to replace my income? So again, you got to figure out where that breaking mark is, what you're going to be able to do, some strategies behind it. And again, that's why working with your business coach here at ABS is going to be able to help you find that dream and find out what you're going to need to do to help you accomplish that goal. And part of helping accomplish that goal is really the other multiple streams of income that ABS has. And this is one of those things where I've seen Adam, again, be very aggressive trying to find some new services that are going to actually help bring in more income for you as a licensee, but it obviously helps the doctors themselves.
Yeah, it's amazing because even when I was doing some of this negotiating with new technology partners, I didn't have to look for them, Eric.
That's right.
Yeah, because they understand that we're the nation's largest network of independent medical billing companies. Now, folks, imagine approaching a doctor and saying, I just opened a local office of a medical billing center here in this city, and I'm a part of the nation's largest network of independent medical billing companies. We do thousands of claims and collect millions in dollars for doctors every day through our system. And we do. You're a part now of our network, so you can use the corporate we when you talk about it.
Absolutely. Well, we're just going to highlight maybe about 4 of these. I mean, you can see there's several of them, and there's some more that are being added. But part of being on the revenue cycle management side of it is collections. And Patrick, a lot of people want to know, gosh, whenever I get into this, am I going to be one of those people that have to call the patients and say, hey, you owe me a lot of money. You owe my doctor some money. You better get it before I call Jimmy out to your house.
Yeah, who wants to be a collection agent? No, but these services are all cloud-based. They all are available to you as a licensee, again, included in your license fee. There's no extra charge for any of these. We do the training. We have the marketing materials. As you can see, these are the flyers for the various services. And every one of these can make you additional revenue in addition to the billing money that we've shown you already. So they're great door openers, because sometimes a doctor doesn't want to talk to you about their billing, but maybe they're having a problem collecting from patients, for example.
And if you think about what Patrick just said, that first came to my mind is, again, your marketing. What are you going to do? How are you going to market your business? And remember, folks, things are really opening up, and not just physically where you're going to go, but there's a lot of things opening up online where you can participate in networking with other people. And so once you start to learn and you go through our training, you're going to learn, again, from the best of the best. What did they do to get their clients, and what did they do to get their first clients? And just being able to share just that little snippet of what Patrick just said to a group of business people, men and women, who are probably already connected with doctors, just saying what he just said, one of those people are going to know, I got somebody that I might need to partner with you to share that information with a doctor. That's the important part about what we do and how we share it. And that's why we have all these different, what we call ancillary services out there, which goes right hand in hand with an auto card, because this is something that can help you build your business, but another way in which you can help the doctors build their business by getting more of those repeat customers coming in for physical exams or for their virtual visits or whatever it might be. This is a great way. And Patrick, I think this is one of the ones that you actually did find to kind of help doctors out, get that message out. Come see me more.
Yeah. And that's what they want, is they want to touch, they want to reach out and touch their patients in a way that's very non-intrusive. Certainly not a phone call. Nowadays, even texts are kind of bug people. But we have an actual system that's online that has over 15,000 different cards already designed to send out. I'm talking about greeting cards in a greeting card envelope. It's actually printed and mailed in full color with your personalized message and pictures inside the card. It's mailed out to the patients automatically at a very lower than you can buy a greeting card in a store. And so you, as one of our business owners, can actually use this too to do your follow-up once you've touched base with the doctor. They're not ready to sign up the first time you talk to them usually. So you simply drip them a card. We call it drip marketing. It's automated. You put it in there and just tell it to send a new card to this doctor every month, reminding them of all the services we have. And Eric, we've proven that works, don't we?
You bet. Yeah, we've seen that work. Everything that we're talking about here has been tested externally and internally. So we've seen it work. So folks, what we're talking about here is not that we just left it up to some of our licensees. As Patrick said, Patrick and I has actually done this. We've done it. We've seen this work. So that really does help give some credibility, because what we've been able to share with you, we know that works. Patrick, as we kind of move forward here, some of the big questions come in about medical billing are these codes. And these next couple of ones that we're going to share with you right now is to help you understand how to handle what people think about medical codes, because a lot of people think, gosh, am I going to have to go to school to learn how to deal with all these medical codes?
Yeah, that's a big thing online. There's people who tout their courses in medical coding. Take this course. It only takes 18 months and costs $4,000. Our local colleges do that as well. Eric, the fact is that if you have the right technology, folks, if you have a system like ours that has all those codes automatically updated Every time any of them change or get updated, when you log into our system, you're looking at the latest codes. And our system actually suggests to the doctor in our electronic medical records system which of the codes they should pick for that particular visit from that patient. So it's all automated. You don't have to memorize anything or know anything about codes, because the doctor is the one who selects those codes right out of our system using their iPad.
Absolutely. And the thing about the codes, the two services that we're going to show you right here, Audit Guard is actually something that can be done prior to you taking over a doctor's billing, because it's going to show them really what's going on. So there's an auditing of their current codes. And again, that's all done by certified professional coders that we have as part of one of your services. And then CodeRight is another service that has to deal with codes that if the doctor wants to go forward and they said, hey, Eric or Patrick or whoever you might be, Larry, Molly, Jessica, anybody that's on the call today that might say, hey, the doctor says, hey, I'm a surgeon, so to say. I just dictate all of my notes. Can you have someone take my notes and convert those into codes so you can do the billing? And the answer is always yes. So we have everything you have to deal with codes, we've got handled here. So one quick question by Molly. And before we go into the last part of where we're going to, she's just asking, can you touch on what happens when a claim is denied? How is that handled? Patrick, you want to take a stab at that, and then I'll kind of wrap up with that?
I'd love to. She must have a background maybe in medical billing, or knows that claims can be denied by the insurance company when they're sent in by the doctor's office. Well, folks, that's because nationwide, doctors have a 20 to 30% rejection rate or denial rate when those claims are first submitted. With our system, we have what's called Claim Scrubber. It's built into the system. It makes sure everything is exactly the way it needs to be accepted. So instead of a 20 to 30% rejection rate like other systems have, our licensees and our system has less than 2% rejection rate. And when it does have that, Molly, is she the one that asked the question? Yeah.
Yes.
Molly, you don't have to worry about that, because we show you exactly how that can be followed up with the insurance company and worked out with them as to what the problem is, how to correct it, and send it back through. There will be rare times that you'd ever have to call a patient. For example, people are always asking about how much interaction with the patients. Well, some doctors don't want you to interact at all. They'll do all the interacting. But the point is, folks, there's very little on the back end that you have to do to make sure that those rejections are resubmitted. Now, there's a certain number, Eric, that just never get accepted because maybe the patient wasn't even eligible. We didn't know that when they came in, but we do now.
You bet. Absolutely. So Molly, the claims rejections are going to be smaller, but if you need to fix those, you're going to be able to see it many times prior to. That's why I'm going to encourage you again, get back with the person that asked you to come to the webinar today, have them go through the demo of iClaim, and your answer, the question to your answer will be answered during that part of it. Patrick, a couple of the new services that we wanted to highlight this afternoon that was in that big old spread, the big old screen that we had, that slide that had all of the rest of them, and that is dental billing and virtual care.
Let's talk about dental billing, because Eric, we've had for many, many years, people ask us, oh, sorry.
That's okay.
Let me clear that off now. I'm not used to this annotation thing here, and you went to the next slide, but that's okay.
You know what? Stay right there. I'm going to go right back to it. There you go. We'll stay right there.
There it is, dental billing. Now, folks, this is a brand new service. In fact, we just had this flyer made this week. That's how new it is. But we've added the dental billing, maybe 3 or 4 months ago, Eric, because we had licensees ask us, do you have dental billing? Well, folks, we've always said, and I'll continue to say, Eric, that is not your biggest market. There's not as many dentists as there are doctors. There's not as many patients that go to dentists on a regular basis. It's just not as profitable. And so we haven't pushed that at all in the past, but we now have our cloud-based dental billing and revenue management system. And so that just was rolled out. And Eric, why don't you talk about the virtual care? That's a pretty new thing too.
You bet. I certainly will. Before we move on to that, you'll see over here on the right-hand side, this is a little clip from that big old document that has everything to do about American business system. So I want to encourage you again to go get that. We're going to show you how to get that here in a moment, but you can see the kind of money that can be made doing some dental billing. But as Patrick said about virtual care, we want to share with you where this is and what's going on, because really, folks, where virtual care is, I mentioned that earlier, underneath that whole technology, that doctors are looking for integrated technology and what can happen here. Well, ABS has been able to tap into the potential revenue with what's called remote patient monitoring or virtual care. And again, this is an area that not a lot of other franchises or business opportunities have even thought about yet. But ABS has been able to integrate that into their complete system. So whenever you're going out there and marketing, so again, for people that are asking questions about how am I going to market my medical billing services to the doctors? Well, you got to remember what you're marketing to the doctor is your revenue cycle management, everything that has to do with that. And part of RCM, revenue cycle management, is virtual care now. So if you don't have a virtual care part of your business, you're already behind the game. And let me show you why. Because an estimated economic impact for a doctor's office that has patients on remote monitoring, or what's called remote patient monitoring, you can see how much money that they could be losing. And here you can see the potential annual revenue to a practice just monitoring 250 Medicare patients per month. Now, folks, again, most doctors have more than 250 Medicare patients that they're monitoring.
Yeah, because, some over 1,000, right? Absolutely,
because half of the doctor's business can be Medicare patients. And so if you think about it, this is $250,000 that could be left upon the table. I love what Patrick says sometimes whenever he says, you know, trying to make sure doctors understand that you're not trying to take away anything from their business, but you're trying to give them back. So the only thing that you're selling to a doctor, if you think about selling, is you're selling their cash, whether it's through the medical billing side of it or through some of these other ancillary services, especially about virtual care. This is something that is a huge economic impact and something that Medicare is pushing doctors to have. Why not have that wrapped in as being a CMRM, a Certified Medical Revenue Manager? Now, what do you make out of it? Again, taking that same 200, it should be 250, not 350. I redid that, but 250. That's giving you a monthly income of $1,750 a month. Again, that's $21,000 a year. And you're not really doing the billing at that point. All you're doing is helping that doctor get an RPM service into there. And again, the great thing about this, Patrick, is that it doesn't take anything away from the doctor. So they're not having to ask their nurses to do anything extra. They're not having to do anything else outside of just saying, hey, patients, I need to put you on this because I need to monitor you.
Right.
Patrick, we pushed this thing all the way up to the top of the hour. We've got just a few more minutes. Hopefully everybody can stick around, because I know that what you want to do is talk to them personally now about what you offer as a business, what you offer them as a money-back guarantee, because there's not a franchise or business opportunity that does what you and Adam do.
Yeah, I came up with this a few years back, Eric, as you know, and everybody in the room thought I was nuts. How can you offer a business opportunity / franchise and give everybody the training, access to all the proprietary materials, and then if they don't like it within 30 days, they can get their money back? I said, well, we either have what we say we have or we don't, and people can make up that decision only if they've gone through our training, all 15 hours of our training, 10 modules, about 90 minutes each. Once they've done that, then they have a complete picture. Folks, think of that training even as a part of your due diligence. Yes, you have to send us the licensing fee up front because we don't know who has it and who doesn't, right? But if you send that to us, that is held in a trust by our attorney until you've completed the training. And if you ask for your money back, we give it back. We've done that, Eric. Yeah. Just a handful of people over the years, but it does happen every once in a while that somebody goes, this isn't what I thought it was. Can I get my money back? We're happy to do that. We want you to go find what does make you happy.
Absolutely. Well, I know that there's about 6 steps, Patrick, you want to kind of take some folks through here. So let's first take a look at this. And we've been talking about this research guide basically the entire webinar today, because we think that this is so important that if you need to, let's look this up. How do they get a copy of this, Patrick?
Yeah, the best way is to get back with the person who invited you to this webinar. Now, we call those people your business development rep. And that person who sent you the email to invited you to this can send you a copy of this 50-page PDF document that has more information than you would even see on our website. Again, we hold this back only for those people who are sincerely interested in the business and can prove to us that they are really, really wanting to get into the business and know more about it. So we'll be glad to send that to you by email if you just request that from the person. If you're not sure who that person is, you'll see on the next slide a phone number and an email address. You can just call that number or email it and say, hey, who's my rep? I don't know who it is. Then step number 2 is browse our YouTube channel. I mentioned that earlier. It's youtube.com. Then put a /YABS, and you'll see literally dozens and maybe over 150 or 200 webinars that we've done in the past. We've recorded them, put them up there, testimonials from some of our successful licensees across the country, and just more information that you'd ever need anywhere. So
absolutely.
Check it out.
And especially if you're looking for those webinars that have to deal specifically with marketing, that's what you're going to want to do. Go back over that YABS YouTube channel, and you'll find that there. Just type in marketing, it'll pop them all up there for you. Patrick, how did they get a hold of some of the licensees? How did they talk to those folks?
Well, first of all, you guys have seen me and Eric. You know that we're a little shady looking, these webcams at least, with these virtual backgrounds. But the point is that we could say anything, right? You don't want to believe somebody on a webinar like this and then send them, $28,000 for a license fee. Ask for an owner reference list. Your ABS rep that I mentioned earlier, they can also send you this, an owner's reference list. That means there's some of the licensees that are on that list, Eric. I forgot we had that slide, but those are real licensees who've been running their business, some of them for 2 years, 3 years, 5. These are real licensees who've decided that they like us enough and appreciate what we've done for them to build their business and change their lives, that they're willing to take a phone call and talk with you. Whatever questions you want to ask, you're welcome to do that. We don't tell them what to say, and we don't, give them a new Tesla or anything like that. So, yeah, ask for that list. You can call them.
And I've made mention of this again throughout the webinar is check out and get a live demo done. I mean, Patrick, this is brilliantly being able to take a licensee, a potential business owner in us, and just stepping through basically the same thing the doctor will see when we do a live demo for the doctors.
Yeah, let that sink in just for a second. Eric, sometimes we have to squeeze so much in here, we don't cover this, but folks, we actually do demos for your prospective doctors. See up in the upper left-hand corner, that's one of our demo guys. Then in the middle is the doctor's office watching it. And then on the bottom right-hand corner, that could be you and your partner or spouse watching and listening to it as well. So you listen to everything that we say, the questions the doctor asks, the answers we give. You don't have to do anything. You don't have to be an expert in running Zoom webinars or anything like that. We do it all for you. You should ask for that demo yourself. Believe me, once you do, you'll realize that this is for real.
Absolutely. And then a purchase agreement. Patrick, if I ask you for a purchase agreement, and do I have to fill that out right now? I think you want them to review that and then find out what the funding instructions are.
Well, sure. And if there's any fine print, there it is. It's only 4 pages. This is not like a regular franchise. A legal franchise has 50-page documents to sign. This is real simple and straightforward. It tells you what we're going to do for you, what you get. It has the guarantee in the agreement as well. So just ask for a copy of that from your rep, and they'll send that to you so you can at least look it over.
Absolutely. And then the last thing you do is once you're ready and you're ready to jump right on in, let's get you signed up and get your training going.
We'll show you how to fund this, folks, because we take cashier's checks, credit cards. We've had people put it on 2 or 3 credit cards, Eric, to be able to get this going. And that's okay. You're just financing yourself. That's all.
You bet.
If the bank doesn't loan you the money, then just loan it to yourself through your credit cards and pay that out over the years or months that it takes to pay it out. The point is, you don't have to worry about trying to finance this thing except through your credit cards, because you can give us gold coins if you want to too.
Absolutely. I mean, you take it in any form, fashion that you can.
That's right.
Absolutely. I think it was we were Adam and I were talking about that one. He says, just bring in the chickens and everything else. We'll figure it all out there.
Exactly.
But anyway, no, folks, if you have any questions, I mean, I think we've got through all the questions that we had today. Hopefully we've made this not only informative, but somewhat entertaining. But let's talk real quickly about what we're going to discuss next week, Patrick.
You know, Eric, I don't know how to share that link with people. Do you in Zoom here? We've been doing
I think we can let me see if I can do that. I think we were able to do that in the chat area that one time, but we will figure that out. Let me see if I can pause this and see if I can't get that done.
Okay, well, I think Adam turned off the chat specifically today, but maybe there's a way in the Q&A, I'm not sure. But anyway, here's the point. Folks, you can also ask for a PDF of all of these slides that we've shown today. So when you get that, zoom in on this and, you know, copy that down if you need to get that into your browser. That's the registration for next week's webinar, Wednesdays, 4 o'clock. We always do these on Wednesdays, 4 o'clock Central Time. This one's on how to launch a medical billing business quickly. So Eric, people ask, how quickly can I get my return on investment, get my first client? How can I build this thing as quickly as possible? We're going to show you how to do that in detail next week.
Absolutely. And if you can't copy that down and it's too complicated there, what we'll do, you're going to be getting emails from us anyway, especially if you've already attended this webinar. You're going to get an invite to the next one anyway. So, Patrick, I think we've gone past the hour today. We packed in much more than what we thought we were going to, but I'm going to put this slide right back up over here so that if people want to get at least this information, they can.
Good. Yes. Folks, you have about, 30 seconds maybe after we say goodbye. We'll leave this on the screen. Jot down the phone number and the email address if you need to, or take a snapshot of this right there on your screen so you have this to follow up on.
Molly says, thank you very much. Thank you, Molly. I appreciate your time this afternoon and everybody else's. Patrick, thank you for taking your time. What a great way. Everybody go enjoy the rest of their evening tonight. Thank you so much.
Thank you. Bye-bye.
Bye-bye.